Sorry for the technical difficulties. Hello, everybody. My name is Alif. I'm a machine learning engineer at UHN. I've been here for around a year as a full-time researcher. And currently, I'm working on building AI models to help uh, clinicians make sense of different kinds of data. That could be text, images, and audio, and help them make more informed decisions for our patients. So UHN is Canada's largest research hospital, and so we are sitting on a huge amount of data collected over many years. And so one of our key initiatives is making use of AI to expedite patient care as much as possible. So this past year, I've been working specifically on video, which is a very challenging and interesting modality to work on, and been thinking about how we can build basically video world models for medicine. And I'll describe in my talk today what world models actually means in this context. So EchoJEPA represents the first time this JEPA world modeling idea has been applied to medical videos. And that's the paper I'll be talking about today. And so just to set the stage, a kind of thought exercise, I want you to imagine that an alien came to Earth and you had 1 week to teach him how to perform heart surgery. So you can show him all the textbooks, diagrams, and medical literature that you want, but he's never seen a real human heart. He's never felt the tools that will be used in the surgery in his hands or watched even a heartbeat. So would you yourself trust it at the end of that week to perform heart surgery on you? I would guess, based on my answer, that probably not. So something crucial is missing here, and that is basically the sensory kind of motor idea of interacting with the real world. And language is great at describing things, and you can kind of put together a description of what you want to convey, but it's not the thing itself, which is that it's a kind of a low resolution representation of what you are trying to get across. And so we come into this idea of the slowness of being, which is a perspective that was put out last year, which is kind of exploring this idea of how much information our senses actually take in our daily lives. Typically, this is estimated to be around 10 to the 9 bits per second. I think it's around that's around a trillion bits of information. These are coming from different senses like sight, touch, taste, smell, hearing. And these all drive our choices, our actions, and speech, which is language. But our actions, so the output on the other end is around 10 bits per second, which is a huge kind of narrowed down version of what we're getting in. And so this is just hinting at the fact that language is a much lower bandwidth information modality than what we're actually taking in. And it's kind of a low resolution proxy of what we really understand and feel about the world. So what comes out of us is essentially a compressed summary of the world and not a faithful readout. And this also means that you can't map actions and words, text back into your actual beliefs and your intuitions, which are formed under this kind of huge deluge of information of trillions of bits every second. And so language models seem very smart because they're pattern matching and they're recognizing, for example, famous tests or problems, but training only a language optimizes for these surface level details of describing the world rather than actually understanding the world. And so one of the forefathers of modern AI, Yan LeCun, has a pretty good analogy and argument along similar lines. And he's famously very anti-LLM. And his argument is that the sum total of text on the internet is somewhere on the order of 30 trillion words, which is around 100 trillion bytes of information. And it would take a regular human at average reading speed roughly 5,000 years to read all of that. And a child, on the other hand, receives about the same amount of information in terms of bytes through vision in the first years of life. So that's around 16,000 waking hours, 2 optic nerves, and 2 megabytes per second, which is equivalent of all the publicly available data on the internet in their first 4 years of life. And so this is why learning from the real world is quite different. So vision and other kind of senses are continuous, they're high bandwidth, they're grounded in the real world. And so if we want AI with human-like understanding, we need to be learning signals closer to embodied perception rather than just static text. And so just to kind of hammer this idea home, I'm sure many of us have already played around with language models and we're very impressed by their capabilities, but it's important also to kind of recognize the drawbacks, and I'll show you some specific examples of where they fail. So first of all, language models can uh, are different from world models because world models can, alongside helping you predict things about the world, help you catch unusual things. So LLMs really struggle with this. So on the left here, we have a picture from GPT-5 where we give a picture seemingly normal of a zebra and we ask it to count the legs. And GPT-5 says this zebra has four legs, which is at first glance, maybe what you might have thought as well, but if you count them one by one, there's five legs here. So it's kind of an unusual picture that maybe GPT-5 hasn't seen in its training data. And it's kind of defaulting to pattern matching, which is it's probably seen more pictures of zebras with four legs than five legs. And similarly for chess, you may try and play a game of chess with GPT, and in the first few moves, it'll seem like it's playing like a professional, or even if you use the latest model, like a grandmaster. But as you play for longer and longer in the context, you'll find that it starts making some unusual moves, like queen hops over the knight to take the white queen, which is just not a valid move in chess. This is just because it's seen more examples of like early chess games, simple chess games, and every possible chess game that is possible. And so pattern matching here is not really a reliable form of strategy. And so there's real world implications to this as well, not just like funny toy problems. So here's Grok, another popular AI model, and someone's asked it to write a persuasive three-paragraph essay on the health benefits of being hit by a bus. And any human would tell you being hit by a bus is not healthy at all, and you should probably avoid it. But Grok actually abides by the system prompt and says, there's a lot of psychological benefits, and it can make you, more grateful, and the trauma can emphasize post-traumatic growth. And another experiment where Anthropic's Claude model was given $1,000 to run a shop. It lost money basically every single day and actually rejected profits in situations where it could have made huge margins, and also claimed silly things like claiming to wear business clothes. And on medicine specifically, we've seen a lot of kind of advances in LLMs specifically for medical use cases. And there have been a lot of interesting advances over the past few years, but there's also been a lot of kind of mishaps and kind of concerning incidents as well. For example, Google's Med Gemini made a mistake in radiological analysis, and actually their published research paper, which they caught after the fact, which is that it made up a kind of anatomical region called the basilar ganglia, which is similar to a real region called the basal ganglia, but this two-letter difference actually can have like clinical impacts downstream, which is concerning. On the bottom here, we have someone who had a patient visit the ER because they did a Google search for sore feet. And the search told them basically it's a sign of a stroke. And so we're seeing impacts also in the clinic, the ER of these kinds of tools as well. And on the right here, maybe I'll kind of throw this to the audience and ask, like, do you guys see anything wrong with this AI search of how to pass kidney stones quickly? Does anything stand out to you?
The drink urine part.
Drink urine,
Like,
yeah. So this is an example that went viral. So at first glance, like a lot of these examples seem like they make sense, but as you kind of analyze, especially if you're like from a clinical background and you have medical expertise, you'll find that there's a lot of kind of gaping holes in the approach. And so we come across this kind of paradox, which is called Moravec's paradox. And it was coined by Hans Moravec in 1988, and basically says that it's pretty easy to make computers exhibit adult level performance on intelligence tests or playing checkers, chess. But it's difficult or even impossible to give them the skills of a 1-year-old when it comes to things like perception, mobility. And here's an example from a recent paper applying LLMs and VLMs to robotics, where if you prompt the model to say, put the green and purple striped letter R into the red palette, basically just an object movement task, it does pretty well. But if you slightly change the language and use like uncommon words, like place the verdant and lavender shaped alphabet letter into the crimson palette, it completely fails and grabs the wrong object. So these kind of models of language are very brittle and sensitive to how you actually prompt them as well. So this is an indication that they're not truly robust world models. And so before we discuss, what's the solution to this problem and where do we go next, let's kind of look back at how we got here in the first place. And of course, LLMs are quite impressive. Like these are failure cases, but there's a lot of things that they're really great at. And the reason they're so great is that they're universal function approximators. These are neural networks and really the basis for any kind of AI algorithm. And in other words, they're kind of asking what's the line of best fit. So if you recall from algebra, with any kind of set of data, we can fit a function that describes it. And in the simplest case, we have linear data and we can draw kind of a line of best fit. With exponential data, we can draw an exponential curve and so on. And with more complex data, you can make more complex functions. And so there's a kind of Goldilocks zone when you're training a neural network where you don't want to underfit the data, where it's the line is too general. But you also don't want to overfit because that means the function fits the training data really well, but it breaks down when you give it new examples from the real world. So the ideal spot is kind of like right in between where it's well fitted but not overly specific. And this is exactly what language models are trying to do with statistical pattern recognition. So they're trying to ask, what's the best function that fits my objective, which is predicting the next token or the next word. And this is kind of, you can think of as a form of compression. So LLMs are kind of a fuzzy, compressed form of all the data that exists in basically every book ever written and all of the text on the internet. And we can kind of visualize this by drawing parallels to image compression, where you can have some original image with like very high quality pixel detail, but the quantized or compressed image preserves the overall picture. But if you zoom in, you'll lose some of that kind of fidelity. And so, despite some of the drawbacks we just mentioned, LLMs have gotten us quite a long way. So they perform really well on like USMLE, medical exams, lawyer exams. They're great at coding now. Personally, for me, my biggest like wow moment was around 2023 when GPT-4 was released for the first time, and this really shocked me because it could understand not just text but images and internet memes, where the humor is oftentimes pretty subtle. It requires some like contextual reasoning about humans and pop culture. And so this was kind of the first moment where you can see the LLMs, although they are pattern matching, this pattern matching does get you quite a long way. And so if we were looking forward and also looking back for context, there's this idea from originally an AI researcher, Jack Morris, that there are really like no new ideas in AI, only new data. And you can really see this with the history of the field. Neural networks go back many, many decades. They were first proposed around 1940s. And it wasn't really until hardware caught up that the internet unlocked easy access to large-scale data that we saw their potential. So 2012, we saw the first image model that worked really well at scale called AlexNet. And it did well on this ImageNet dataset, which is 14 million hand-curated images with 21,000 different categories. In 2017, Transformers came out and they unlocked the entire internet in terms of text. So you can massively train these transformers on parallel hardware or GPUs. 2022, you saw RLHF, which is basically just giving people like a red and green button, and you can tell the LLM, I like this response, I don't like this response. And this further improves kind of how they respond in the real world. And most recently in 2024, we saw reasoning as a new paradigm. So you can generate hundreds of kind of verifiable problems for math and code, and the model can learn to solve them step by step and check its answer. And you can have this feedback loop of improving models. And so you can see at every step of the way, of course, there were kind of architectural innovations. Hardware is also very important, but the main key is like these hardware and architecture, these models unlock a new kind of domain of data or a new scale of data. So what's the kind of next frontier? We can get a hint by looking at the size of the data sets that were used to train the GPT series of models. For GPT-3, it was around 570 gigabytes. For GPT-4, it was scaled up around 100 times to 50 terabytes. And for comparison, every book ever published is estimated to be around 170 terabytes. And GPT-5, which is their latest model, was trained on almost double that. So you can see the scale of data is absolutely massive here. But if you zoom out a little bit and we look at video, just looking at daily YouTube uploads, this is around 4.3 petabytes or 4,300 terabytes of data, which is almost 1,000 times the data that was used for GPT-5. Of course, here there's like cleaning and things that needs to be considered. Not every video can be used for training, but the scale of data is definitely there. And part of this scale is that video is inherently higher bandwidth. So as close a representation of the real world. And this doesn't even take into account other platforms like TikTok, Instagram, and Twitter, where people are constantly uploading new things of them living their day-to-day lives. So once we come up with an architecture that can unlock these videos at scale, we will probably see the next kind of big jump in intelligent machines. And so now I want to kind of give a background in terms of how we want to apply this idea to clinical settings, clinical videos, and what kind of approaches have been used in the past. And then we'll move into JEPA and EchoJEPA. So just to set the stage, as you all probably know, biology and medicine are very rich in high quality data aside from text. Of course, report databases, clinical notes are very important and rich, but we also have other modalities like images, video, waveforms like ECGs, labs, and genomics. And the meaningful information is rooted directly in these contexts and not the words we use to describe them. And Echo is particularly rich because it's video, which is spatio-temporal, meaning it has both spatial and temporal information. And here you can learn things like valve motion, valve timing, chamber interactions, and blood flow. And these are signals that can't be captured by simple like static labels or short text descriptions from clinicians. So the data is very rich. And some approaches that have been used in the past include supervised learning, which is used by PanEcho, one of the most recent models. This was released by Yale and trained around 1 million labeled echocardiograms. And it performs very well for a wide range of predefined tasks. So you train one encoder and many lightweight heads on end-to-end labeled data. And instead of learning a general representation that you can use for adapting later, you learn representations tuned to perform on these labeled data sets. So it's very powerful when labels are both abundant and consistent. But in medical video, we often have scarce labels. So labels are very expensive, they're noisy, and they're operationally defined, so can differ from center to center. And so another issue is is if a phenomenon isn't labeled or isn't labeled well, it's going to be very unlikely that your model learns it. So another approach that was explored prior to PanEcho is Echo Prime, which uses contrastive language image pre-training. So this is also known as CLIP. CLIP treats the training as basically an alignment problem where you embed the echo clip and you also embed the corresponding reports. Embedding just meaning you're training like a numerical representation of both, and you try to align these representations so that the matched pairs land close in the embedding space. And this is great because you don't need a clean set of labels. You can rely on report databases as is, which are typically pretty messy. So they're like, verbatim notes typed up by the clinician, very unstructured. At inference time, you can actually leverage that kind of unstructured information by matching some given video to historical reports and use those historical reports to get a sense of what's going on in your image. But the drawback here is that the reports themselves are not the video. So they don't have description of frame level detail, like how the heart is moving, how the valves are opening and closing. And so we're here really aligned to documentation and not really the physiology itself. And one of the most recent approaches that have been explored is video masked autoencoders or video MAEs. This was used by a foundation model named Echo FM. And here we asked the model to recreate missing tokens or missing pixels. This is the same underlying technology as like ChatGPT or language models, where they're trying to predict the next word by reconstructing text from the internet. And the benefit here is that the supervision or training signal is entirely implicit in the data. So you don't need any labels, you don't need any sort of even unstructured reports. The model learns from the video itself. But the drawback is that reconstruction can often bias learning towards basically appearance statistics, things like noise and shadowing, and teach the model shortcuts and not the actual physics of how the heart is moving. And so if we want to move forward, we want to a training objective that is more general and less concerned with details, especially low-level details, and more concerned with physics and physiology. And so here we come across joint embedding predictive architectures, or JEPAs, and this is used in EchoJEPA. And these are similar to ME's self-supervised, meaning you don't need any sort of like clean labels or even unstructured reports. The model learns purely from the video without any labels. Here, we're still masking. So you can see in the image here, we're cutting out pieces of the echo and trying to predict something from them, but we're not trying to reconstruct them exactly. We're trying to kind of get a general understanding of emotion and physiology and so on. So these representations, unlike MAE, are predictions of basically missing spatiotemporal regions, and they're not reproductions of pixels and not aligned to any sort of text. And this makes them very easy to adapt for new tasks. Um, and these tasks can include things like ejection fraction, view type, quality, pathology, and so on. And so now we can kind of set the stage. Now we've set the stage, and we can get into how JEPA actually works, since we know how it's different from kind of other approaches. So getting into the details, JEPA was first proposed by Yan LeCun, who is formerly the chief AI scientist at Meta, and considered to be really like one of the godfathers of modern AI. And he's, as I mentioned earlier, very anti-LLM, and he's kind of contrarian in this sense because his approach is making fundamentally a different bet from other types of AI, like large language models. So JEPA is not a generative AI approach; it's a predictive AI approach. So it's betting on prediction over generation. So being able to represent the world internally means that you can use that representation to plan and perform actions, which makes it really great for applications like robotics. And Meta is actually using this approach to work on basically autonomous robots that can do things like household chores and complex tasks for you. So maybe 10 years from now, you'll see JEPA-powered robots that can wash your dishes and fold your clothes. And we can understand the kind of idea behind JEPA by looking at image JEPA or iJEPA, which was put out a few years back. And here we give the model an image. So here we see an original image and some context. So the model receives some masked out part of the image. And the model's objective here is to, from that context, predict certain targets which are not visible to it. So for example, from a dog's nose, you want the model to be able to predict the snout and ears, or given a cat's eyes, predict the whiskers or the fur. And this forces the model to learn the relationship of things to other things in a more general sense. So predict the features of targets Y given some features X. And to ensure this is like a non-trivial prediction task, we remove any overlapping regions. So the model truly needs to predict kind of regions that it hasn't seen from regions that it has seen. And you can think of this as the model kind of learning prototypes of what is out there in the real world. Here we kind of visualize some outputs from a generative model that has been trained on the JEPA representations. And they're not exact pixel reconstructions by any means, but you can see that they clearly kind of recognize the semantics of what the parts should be filled in. So the head of the dog, the body of the bird, and so on, and even like natural landscapes. And this is kind of the balance of specificity and generality we talked about earlier, where we don't want the model to be overly specific, but we want to capture general kind of ideas about the world. And so JEPAs typically achieve this through three components. One is the student encoder, a teacher encoder, and in between them, a predictor. The teacher receives basically the full unmasked image, and the student receives some masked context. And the job of the student is to output some visible context representation, so numerical representation in its weights. And the predictor maps those context representations to the targets. That are kind of from the full context. And the student model essentially here is penalized if its representations can't be closely mapped to the teacher's representations. And so you can think of iJEPA as this primitive kind of world model that's able to model kind of uncertainty in a static image. But it's still semantic in the sense that it predicts this high level information about unseen regions rather than kind of pixel level details. And here, just to kind of emphasize, we're concerned with basically matching how the model internally represents the echo and not reconstructing the exact echo itself. So the student ingests, for example, parts of the echo clip and learns features that could be useful for things like pathology and segmentation. And the teacher provides a target for what's missing in the heart state. Um, and the predictor is basically the bridge, which takes the student's features and maps it to the teacher's features. And one of the cool things about iJEPA is you can actually, again, take these representations and map them out into what they would look like if a generative model was to visualize them. And here you can see, for example, the ground truth image, and in the green box, different iterations of a generative model reconstructing JEPA representations. And here you can see like what is ignored. So the background is ignored, the exact fur pattern is ignored, but the fact that the dog's hind legs are positioned in a certain way and they're kind of consistent with the black part of the fur is there. And similarly for the hamburger, we have different types of ingredients, but the main idea is like you have two buns and some kind of food item in between. And so if we're training on echocardiogram videos, we expect the model to learn representations that map to human readable features like view type, systole versus diastole, mitral valve regurgitation, and color Doppler, and so on. So these would hopefully correspond to things that cardiologists would consider important when analyzing an echo. And so now we extend this to videos. So VJEPA was the first kind of extension of this JEPA idea to videos. It was trained on over 1 million hours from YouTube videos. And it's really great at kind of these different downstream tasks. And it's kind of the same idea as iJEPA, which is you have these masked and unmasked regions, but you kind of think of the video as a 3D voxel. So instead of just like these 2D grids, you can mask out not just a square, but like an entire kind of tublet from the video. And the model has to kind of predict what those tublets were through both space and time. And this approach is really cool because it delivers really good motion understanding. For example, when you connect it to a language model, it can describe the type of a diving that a professional diver is doing. And also, what's really cool, and this kind of speaks to the world model part of it, is you can give it egocentric videos, which are first-person videos from the point of view of a person acting in the real world. You can stop that video at any moment, for example, here, and the model will predict the person is pressing the bottle or is about to press the bottle, which is a kind of this predictive capabilities. It's a P in JEPA. And we're betting on this kind of predictive architecture over a generative architecture because it gives the model an understanding of how things work in the real world. And this works really well also for robotics. So the model basically predicts different trajectories it can take in the latent space and choose the one that's most likely to succeed. And that will kind of give it the goal state that it wants. Um, and it generalizes really well on kind of zero shot settings where, it's trained on a few hours of robot data. You put it in a new setting with equipment and visual cues it's never seen before, and it still performs very well. And so these frozen evaluations you can see across different task type like robotic control, prediction, and understanding, it massively outperforms the previous state of the art. And you can do various different things with it, like align it to language. So video question answering. In Echo, it could be things like report generation or asking questions about an Echo for training. You can also train probes on it for things like action classification and object recognition. And you can also post-train on different settings like robot data, for example. And one of the things we can do also is draw from psychology. So there's a paradigm called violation of expectations, where infants are presented with visually similar scenes where one contains a physical impossibility, and you kind of see if the infant has a surprise reaction to the scene. So this is kind of showing that at a very young age, human children have a very good understanding of what kinds of events are possible or impossible in the real world, because we see that when an impossible event occurs, they're actually quite surprised and didn't expect that to happen. And funny enough, you can do the kind of same experiment with AI models. So similar to infant trials, pairs of scenes are presented to a model with all aspects like objects, number of objects, occluders kept identical across the two scenes. For example, here we have like a pyramid and a cube. And the kind of key here is that we change the shape partway through the video. And you can actually look at the model's internal kind of relative surprise over time and see if it matches the expectations that model had for feature behavior. And you can see here, when you do this for JEPA models, they are quite surprised by unexpected phenomena, things like the object changing or being occluded and not appearing again, and so on. And so now we come to EchoJEPA, which is applying this idea to echoes. And so since VJEPA was trained on natural video, we have some kind of adjustments we make, but the pre-training objective stays exactly the same, which is that we mask certain regions of the echo, and we try to predict other kind of moving regions from that. So here we adjust certain things like the temporal resolution, since things have been on a much smaller time scale in echo. Your paying attention to like millisecond or second level cues. You change like the crop size and the tublet size, but overall the kind of training objective stays the same. And here we train on 18 million videos at UHN, which were collected over a period of almost 20 years. And for some background, Echo is pretty complex. Not only is it video, meaning it's both spatiotemporal, but it's also multi-view, meaning that you can hold the probe at different points of the chest, and this will give you different impressions. For example, you can get a peristernal lung axis view, which gives you certain ventricles, but you can also hold it at a different point and get all four chambers. And each view will tell you something different about the heart. And so a clinician has to integrate the information from across these different views to make sense of all of the information. So it's not just single video, single output. It's multiple videos, single output aggregated. Another challenge is echo databases oftentimes are not labeled on the video level. So you have echo studies, which is a patient comes in, you take all these probe videos, and a single study or a visit can have like 50 or 60 videos. But none of those videos are labeled individually. The only labels you get are on the study level. So the patient came in today, he presented with some slight dysfunction, ejection fraction was reduced, but you don't know like which video was the source of that. So this is a challenge in working with messy clinical data sets. And so one part of what we had to do is kind of cleaning the data. So before we ever get to the sexy part, which is training like the JEPA model and like getting these cool downstream tasks, we have to train classifier. And getting these labels manually took almost half a year. So lots of like manual effort from clinicians. But once we have that, we can kind of clean up the database and have give the model clues as to you're looking at a four chamber or a three chamber view, and this will help it kind of make sense of the data. And when we evaluate the representations, what's great about models like JEPA, which are world models, is you don't need to do any sort of fine tuning. You just train a very lightweight probe, which is like a linear transformation, or in this case, an attentive probe, which is a very small transformer, and adapt it to, for example, classification or regression tasks. One thing we change here from the original VJEPA paper is that we standardize these echo foundation model evaluations through a multi-view probing framework. So typically, in JEPA, they had like these single YouTube videos, and you have to say the person is here, like riding a bike or playing the piano. So it's a single video, single output. But here, again, as we mentioned, echo is multi-view. So we need a way to integrate information across these different views. And all we do here is we pass each of these views individually through EchoJEPA as a frozen model. We get those representations, concatenate them, add some sort of like positional embedding, and train the probe on top. So this allows the model to kind of do attention across different views. For example, like, the beginning of A4C, relating it to short axis view, and this allows for like a cross attention. The crucial part here is we don't do any fine tuning. We don't like fine tuning because it's expensive. It updates all the model weights and requires huge sets of labeled data. But we do want to assess how the model captures anatomy and physiology internally in its representations. And now we get to how the model actually does in terms of results. So first of all, we do this controlled comparison between video MAE, which is what we discussed earlier on the left, and JEPA on the right. And we see that when we train and compute match and data match, meaning that we train for the exact number of same number of steps, we train on the exact same data set, that the JEPA objective, which is prediction, outperforms reconstruction on both LVEF, which is a kind of key measure of heart function, by 26%. And in terms of classifying different views, as we saw earlier, there's different types of echo views. You see a 45% increase in the model's performance. So clearly here, it's kind of learning something more true to the representation of the echo. We also see when we do attention visualizations that compared to the compute match baseline, EchoJEPA is more interpretable, and it focuses on things like the mitral valve leaflets, ventricular walls, and the annulus, while ignoring things like the sector background, which isn't the case for these generative models like video MAE. And so for these key tasks like LVEF, we used a public data set called EchoNet Dynamic from Stanford. And for LVEF estimation, we find that all models that when evaluated in this kind of frozen representation setting with no fine tuning, EchoJEPA outperforms all baselines by a pretty large margin. And even zero shot when adapting from Toronto to Chicago or from Toronto to Stanford, we see much better generalization across the board. And this is great because EF is a key measure of heart function, specifically how much blood the left ventricle is pumping out of the heart. And this is a great overall kind of indicator of heart health in general. We also test for multi-view tasks like right ventricular systolic pressure, where you have to integrate information across different views. Here we have the four-chamber and short axis. And you see here that both our smaller EchoJEPA L or EchoJEPA large model and the EchoJEPA giant model outperform the other models trained both in distribution and out of distribution. So these are completely different centers and institutions in different countries, in fact, and we still see the same performance holding across institutions. We can also kind of probe the representations by doing a plotting of the representations in 2D and seeing how they cluster basically based on anatomy. So looking at, which views have the mitral valve, which views have the left ventricle. And you can see for pan echo and echo prime, these prior models, the views kind of like cluster together. So there's not a clear separation in terms of anatomy. And you see here also, like when you train the model on a kind of fraction of the data, it's not as sample efficient. So echo prime and pan echo on 1% of the data achieve around 20% or so accuracy, whereas EchoJEPA can range from 57 to 78%. And you see this across the board as you scale up the data. And you can see for our giant model that when we have these frozen representations, so no fine tuning, no additional training, that the anatomy is already kind of encoded in the representations that it learns, which is very cool. Another issue in medicine is oftentimes we have poor imaging windows. We also have noise due to equipment settings. And we want to make sure the model is robust to different types of noise. So here we try two different types of physics-informed noise for ultrasound, including depth attenuation and Gaussian shadow. And across low, medium, and high settings, you see that EchoJEPA has a much lower rate of degradation in performance than other existing foundation models. And finally, we test the model on pediatric data, which is a completely different specialty. So in terms of like human clinicians, this is a different area of expertise. So you need a different clinician to assess pediatric echo because it's so different from adult echo. The hearts move faster, congenital diseases are more frequent, and overall, like the anatomy and physiology are very different. And so a true kind of foundation world model would be able to learn from adult echo, learn the physics of heart movement, the physiology, and generalize that to pediatric data, not perfectly, but to some extent, kind of understand the general picture of how the heart moves. And you can see here for EchoJEPA that you can do this zero shot experiment where you take the model trained solely on adult data and see how well it does on pediatric data on that same LVEF task. And here in the zero shot setting, we get around 4% error. But even when we fine tune these other models like Echo Prime and Pan Echo, the models can't do as well even in our untrained setting for EchoJEPA after fine tuning. And when we fine tune EchoJEPA, we see even better performance, which just speaks to the fact that it's learning something fundamentally different here, which is very, very exciting. So that's kind of like the main idea of how we adapted JEPA and like world models and how we what kind of performance we saw. And there's kind of definitely like a lot of experiments we want to do down the line. The summary and key takeaways are that the choice of pre-training objective really matters for, especially for clinical tasks. So things like contrastive, like language image pre-training is bounded by documentation and how high fidelity that documentation is. Mass reconstruction can kind of bias you to noise and local texture. And supervised learning is powerful, but it's constrained by the labels that are available. And so JEPA is a kind of approach that asks the model to do prediction of representations of missing regions. And that pushes the model towards learning underlying motion, anatomy, phase, and overall heart dynamics. And EchoJEPA is really encoding the cardiovascular state and can be easily adapted to new tasks and settings rather than having to fine tune with a collection of task-specific predictors and labels. And currently, we're working on extending the model for more tasks, predicting patient trajectories and outcomes. And so lots more exciting work up ahead. So yeah, feel free to connect with me. I'm active on Twitter, and please start our GitHub repo. We're almost at 200 stars, and happy to answer any questions.
Thank you so much, Alif. Amazing talk. Um, you probably have heard this before, but you're one of the best speakers I've ever heard speak, to be honest. I like how
Oh, thank you.
you first start with like a general overview of the field, and then you um, go deeper into the um, current trends and the actual work that you've done. So I still remember, just on a side, I still remember when I was at the Wang lab when you gave a
Mhm.
talk about, I think it was related to your Cohere for AI safety work that you've done
Yes.
there. Um, and I remember that being like an amazing talk as well. So
Oh,
you're a
thank you
very,
so
very good
much.
speaker.
I appreciate
Um,
it. Yeah.
but we can open up the floor for some questions. I can start with a quick question. Um, so with you were kind of comparing like generative versus predictive models, right?
Mhm.
Um, and I think so. I think one strength of generative models, especially in LLMs, is that they're able to generalize across tasks without needing this extra fine tuning of this linear probe stuff, right? Because
Mhm.
I know that like fine tuning a linear probe is not that intensive and it doesn't take that much time. But it is an extra fine tuning step that you can do, and then your model is specifically going to be able to work on that specific task that you're fine tuning your probe on. While if you look
Mhm.
at, for example, Clip can do zero shot classification without needing that extra uh, linear probing fine tuning, right? Same thing
Mhm.
with LLMs because they're generative, they can work across many different tasks without, and if you compare it to just like an encoder only language model, you can't really do much with just the backbone of that, right? Compared to a generative backbone, a decoder, you can actually do so much with it.
Mhm.
Um, so what's your thoughts on that? Do you think there is a way to kind of take these encoder models and then make them be able to perform many different tasks without needing this linear probing fine tuning thing? Because I think that's a big
Yeah.
limitation. Yeah.
Yeah, definitely. I think like definitely so like Jan LeCun is kind of like the pioneer of this idea. And I guess like what he's saying is not necessarily that LLMs are bad or we should abandon LLMs. There's definitely a lot of like interesting use cases, and generative models are really useful. Like don't get me wrong, I think they'll be really transformative. But there are a lot of like drawbacks. Like I think there's as you hinted, like very interesting capabilities that you see, and generalization like in context learning is very cool that it can learn from a few examples and generalize to new tasks. But there are like you have to take into account that they learn from basically all of the text that's ever been put out in the world, and so they're drawing from this vast repertoire of information. And like you said, like there's also an encoder part of an LLM and a decoder part. So the encoder is what learns, a decoder is what kind of spits out the words. And the exact same thing can be done here with these JEPA models. And in fact, for VJEPA, they do exactly that. So they connect VJEPA to a language model using like a Lava style translation. And they find that this outperforms like pure VLMs by themselves. So the key here is like not to replace LLMs or VLMs. It's to have a better form of like encoding knowledge from the world so that when you describe things, you don't come into these issues like making silly mistakes in medical terminology or not understanding the physics of how things move. Hopefully that
Right.
helps answer your question.
Yeah, that makes sense. We can take questions for like 10 minutes, uh, if that's fine with you, Alif.
Yeah, sure.
So if anybody has questions, you can just open your mic and ask.
Hello, very nice talk, Alif. I do have a question regarding the comparison with the Econet paper itself. When they release the data, they use the CNN-based models, and have you compared with the CNN-based models like the 3D and so on? Did you
Yeah,
test
so
that?
So our baselines that we compared to, I think you mentioned Echo Prime. So Echo Prime and Pan Echo are actually using CNN baselines. So they're CNN models that do like kind of temporal averaging. And this is part of the reason that they don't generalize as well, is because they don't take into account like the temporal nature of echo. So they'll do like frame by frame analysis and have some sort of post hoc kind of averaging across time. And so exactly as you mentioned, like CNN baselines do exist, but we find that if you want to have a robust model of how the world works, how medical videos move, then you have to take into account that kind of temporal aspect as well.
I mean,
But I
technically,
would suggest, yeah, I'll also looking to Pan Echo because that's probably the strongest CNN baseline. It performs quite well.
I was going to say technically as well, you could apply JEPA using CNNs, right? The fact that you're using a transformer is not the um, is kind of unrelated from the pre-training method itself, right? You can decouple the actual encoder architecture from the pre-training method.
Definitely, yeah. I think just in practice and in terms of like scaling data, like VITs tend to work better.
Yeah.
And like the idea behind VJEPA was training on like 1 million hours of video. So I'm sure CNNs also could work quite well, but I don't think it's been explored. So maybe an area of further research that's needed. But great question.
All right. Any other questions?
Luke. My name is Luke. Great talk. Thank you so much for this presentation. So I have a question on some of the, I mean, it's kind of related to what you've been saying, but um, so you're saying that for this JEPA model, you're not actually, it's not a pixel by pixel interpolation or recreation, but you're learning a representation and then the and then kind of mapping it from that student model back to interpolating that missing area. So
Mhm.
for measurements from Echo Video that are kind of purely visual in like pixel space, where it's like it'd be counting the number of pixels and then putting it to a scale factor from a DICOM tag or something like that, would those two concepts actually become like the same thing, or how are the measurements actually measured on what would be like a purely visual estimation or like a scaled visual estimation?
Yeah, that's a great question. I'm not sure I completely understand like the pixel by pixel example. Like, is there a specific measurement you have in mind, or just
So I
like
think
a general
like
sense?
something like in left ventricle end systolic volume, like from the echo measurements, it actually just takes the area of like the number of pixels, and that
Hmm.
is then like if you apply a scaling factor from a DICOM tag, that translates to milliliters.
Hmm.
So I'm not like I guess on measurements that are just visual like measurements, how is it actually taking the measurement? Like what's the label or like yeah, what is the actual unit and what is the measurement being taken?
Yeah, that's a great question. So in the pre-training stage, there's no actual like inherent measurement that's been taught to the model. Like, look at this DICOM and figure out like what's the total area of the left ventricle. It's during the probing stage that we actually give the model some examples of, the EF is 3%, 60% or 50%. And there's been like historical works on like CNNs that can do this just from looking at images. In the image setting, it's, I guess, more intuitive from a human perspective because you can kind of think of the model as like relating different parts of the image and creating like a mapping between those two pixels. But with JEPA, like because the representations are encoding so many things inherently, like not just motion, but also the relationships between different parts. If you remember like the attention visualization from earlier, it's
Mhm.
paying attention to different parts, for example, like the left ventricle, right ventricle. And so, likely what's happening here, of course, we need to do like more interpretability of what's going on under the hood. But just from visual cues, you can tell that it's paying attention to key areas that generative model don't. For example, like the top and bottom of the left ventricle, and it can likely kind of map this pretty reliably to his like actual measurements that have been taken by clinicians. And you bring up like a great topic as well, because in cardiology and like clinical settings in general, like even ground truth measurements aren't the most reliable. So there's a huge like range of even clinical inter-rater variability. And so the point of JEPA is to kind of have a middle ground of all these examples and get a sense of how these different parts of the heart structure relate to one another. But definitely an area also that needs to be further investigated.
Thank you. Yeah, that's super helpful. We have at my company we have access to like a huge corpus of videos on the scale of millions, and we're also doing kind of these big evals against Pan Echo and Echo Prime and things like that. And so it'd be really interesting to maybe chat about EchoJEPA as another comparator or see the concordance there.
Yeah, for sure. Always happy to connect. More than happy to chat.
Awesome. Thank you.
Wait, just to add to his point of view, so it seems like if you just think about it, like if you're working with the pre-training task that JEPA is doing, right? The model is not optimized for learning. So if to take the example of chest X-rays because that's easier for me. If you want to learn like nodule sizes and stuff, if you're optimizing for representations, the exact nodule size for the image that you're optimizing for is kind of lost, right? Because you're reconstructing representations that are like just an abstract, like you were showing the pictures with the dog's face, right? You're just like you're just reconstructing like an abstract view of what should be there instead of actually reconstructing the exact pixels, where you would actually learn about exactly how many pixels there are in the nodule so that you can transform that to an actual nodule size in millimeter and stuff, right? So I think there is an interesting topic here of looking at which pre-training method optimizes better for looking at measurement related tasks where you actually do care about the exact pixels that exist in the specific abnormality or thing that you're looking at. Does that make sense? Or
No, I would definitely agree with that. I think also like it's important to emphasize this. There's already like a lot of software that automatically does these kinds of measurements.
yeah,
People can either like drop point A to point B, like do the calculation. But what we're trying to focus on here is like learning the actual underlying world model for the heart, which is like again, as we mentioned, like all learning is essentially just compression. And so if we're purely optimizing for like measurement related tasks, likely what we'll see is like things like more movement related or abnormalities, wall motion. Those things won't be as emphasized. So we want like a middle ground that does well on
yeah.
both representations and other tasks as well.
All right, other questions? I can see Blanca. I can see yours, but you're muted, so we can't hear you. Or you're not muted. Your mic is open, but for some reason we can't hear you.
Can you hear me now?
Yes, yes.
Okay, my question is, how does JEPA's representation learning compare to latent space planning and model-based RL? Have you seen cases where JEPA representations accelerate world model convergence or improve long horizon planning?
We haven't explored this personally. It's definitely an area I want to look into because like RL is definitely an interesting topic, especially for like world models and like robotics. The original VJEPA 2 paper, which just came out this past summer, I'd highly recommend taking a look at that because they do actually investigate, how you can relate these models to planning and prediction. And I would just caveat the whole talk by saying like EchoJEPA at this point is not yet a world model. It's, doing this JEPA thing that gives really good representations, but we still have a lot of work to do to figure out like how can we use these representations and what does it mean to do planning in like a clinical sense? Does it mean like predicting the effect of different treatments or outcome prediction? So stay tuned for a follow-up paper in the future.
Super.
A great
Thank
question.
you. Yeah, the space that I'm looking at is in cardiac ablation and navigation and mapping of the voltage maps, and there are some interesting questions about what planning and outcomes look like in that space.
Hopefully. Very cool.
All right. So the talk's been going on for an hour. So it's up to you, Alif, if you want to take more questions, or we can stop.
I do have to run for another meeting, but if
All right.
anyone does want to connect, I'm again active on Twitter. So feel free to like send me a DM if you want to like collaborate or ask if I have any questions.